IPF patient journey. Oxygen therapy.
Oxygen is a basic need for human life. A constant supply of oxygen is required by every cell, tissue, and organ in the body to keep functioning properly. Normally, the lungs absorb oxygen from the air we breathe. It passes into the blood vessels that surround the lungs and is carried to all cells of the body by the blood. However, certain breathing disorders can affect the transfer of oxygen from the lungs into the blood. As a result, the oxygen level in the blood drops, and the body's tissues and cells do not receive the oxygen they need. People with these lung diseases may require extra oxygen to maintain the body's normal functions. Let's meet Phil.
Hello.
He is affected by IPF, a serious lung disease that prevents him from getting enough oxygen when breathing normal air during his daily activities.
Based on the results of several tests conducted during exercise, his pulmonologist Dr. Iris decides to prescribe him supplemental oxygen, to ensure that his organs are getting enough oxygen to function properly. In order to introduce Phil to the topic, Dr. Iris explains that oxygen can be delivered as one of three types: as liquid oxygen, as compressed gas, or in a concentrated form.
Liquid oxygen is produced by supercooling oxygen gas, which changes it to a liquid. Since liquid oxygen needs less space than other forms of oxygen, it can easily be stored in smaller, more convenient containers and allows patients to have a wider action radius. Compressed oxygen gas is stored in metal cylinders under high pressure. Although the cylinders are available in a variety of sizes, they are often heavier than containers for liquid oxygen. Therefore, compressed oxygen is mostly prescribed at a later terminal stage of the disease when the patients are forced to adopt a more sedentary way of living. Oxygen concentrators provide oxygen by concentrating the oxygen that is already in the air and removing other naturally occurring gases. These devices are less expensive because they don't require oxygen refills, but they require electricity.
Based on his individual situation and the fact that he is still active, Dr. Iris recommends that Phil uses liquid oxygen during the day and an oxygen concentrator while sleeping. As the test results show that Phil's blood oxygen levels already drop very rapidly after minor activity, he needs to use his supplemental oxygen continuously. Furthermore, Phil is informed that during exercise people use more energy and therefore the amount of supplemental oxygen also needs to be adapted to the situation. To make sure Phil is using his oxygen correctly and safely, he is briefed on some safety instructions when using his oxygen.
Never smoke and avoid being around people who are smoking while using oxygen. This is because oxygen supports combustion. Also be cautious with oxygen tanks around open flames and heaters. Store oxygen tanks in a safe area or by securing them to a fixed object.
Now that Phil receives his extra oxygen, it helps him to function better, decreases his shortness of breath, improves his sleep and has improved his overall quality of life. Like most patients who require extra oxygen to treat their chronic illness, Phil will need long-term oxygen therapy. But this doesn't mean that he has to limit his daily routines. Phil tries to continue doing things he enjoys, looking forward for social events like getting together with friends or playing with his grandchildren. Noticing that the extra oxygen gives him more space and energy to perform these activities. Apart from that, Phil experiences that since receiving oxygen he can achieve more with physical training and enhance his functional capacities. Suddenly the same activity is less tiring. And even if he wants to go on a holiday, the extra oxygen wouldn't automatically cut his holiday hopes short. Phil understands that the best thing he can do is to accept his situation, be mindful of the present moment and try to enjoy life as much as possible, without letting his illness and the oxygen get in the way.
Do not forget, you are more than your disease.